Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. For many countries, 2021 started with lockdowns, with worries over the then new Delta variant of COVID-19. But at the outset, many had hoped that this would be the year that perhaps we could move past this pandemic. However, the dark cloud, as we all know, of COVID-19 is still hanging over all of us, with most countries now under yet more restrictions because of this more infectious but potentially less severe Omicron variant. In many developed countries, including South Korea, the vaccine rollout expanded quickly, with tens of millions of people being jabbed over the course of the year, and medical staff basically working their way down the list of the most at-risk groups first. Then came the booster jabs as concerns rose that vaccine protection was waning for those who had their shots earlier in the year. So we wanted to ask, where do we stand as of now as we head into 2022?
Well, so far it is looking like there will be yet more restrictions to deal with. What some experts fear will be a tidal wave of Omicron. For more on where we stand globally in regards to the Omicron strain, we're joined by Professor Michael Toole, an epidemiologist at the Burnet Institute in Melbourne. Professor, now many countries are seeing a record number of cases since the emergence of Omicron, but so far there's a sense of, well, cautious optimism that Omicron may not be as severe. Doesn't seem to be filling up hospitals so fast. Do you think this suggests that people may finally be learning to live with COVID?
Good morning. I think it's a little bit early to conclude that. As you said, cases are just skyrocketing. So far, mainly in Europe, North America, but it's not a seasonal thing. It's nothing to do with winter. Down here in Australia, it's summer, and we're reporting around 20,000 cases a day, and it's increasing by about 50% every day. So I think while for an individual, the news that it's milder is good. At a population level, if you have so many cases and just a small fraction end up in hospital, that could still overwhelm the hospital system.
Yeah, now a number of experts have said, I know there's a wide range of opinions because as of yet 100% of what Omicron isn't yet known, but they have said COVID just isn't as severe in its current form as it was, say, a year ago, citing in many countries the fact that fewer people are going to hospital and there are a lot fewer deaths from Omicron than there were of Delta or previous strains. Now, given the data available to us as we speak, would you be in favour of loosening restrictions, or do you think they should stay the same or perhaps even be made even tougher?
I think at least they should stay the same, as I think they will in Australia. But of course, we're a federation, so they vary state by state. In the state I'm in, there are vaccine mandates to enter restaurants or other hospitality venues. Indoor masks are mandatory. There are density limits on indoor settings and QR code check-ins. And I think that's the minimum. Now, I think we have to, get out our calculators and do a bit of arithmetic. Let's say on a day in somewhere, a town somewhere, there were 1,000 Delta cases. On average, 5% were hospitalised. That's 50 people each day. Now move forward, when you have 10,000 cases of Omicron, even if only 1% were hospitalised, well, that's 100 people, twice as many. Now, once they get to hospital, they may not need to go to ICU, but it's still a big stress on the hospital system. And we're seeing that, for example, in Sydney, where the number of people in hospital is going up by about 100 every day. And, saying 1% is much lower than the data. The data that I rely on so far is from England, Scotland, Denmark, and South Africa. And those studies show that Omicron is between 30 and 70% less severe than Delta. So I'd take the middle figure of 50%.
And Professor, well, South Korea, the United States and other countries have slashed the length of quarantine for people who test positive with Omicron from a couple of weeks to around 1 week in some nations. What's your opinion on these decisions?
Well, I think the data that I've seen from the US is very convincing. So they've cut the amount of time you isolate to 7 days. And that's based on the fact that they have found that people with Omicron are infectious for a shorter period of time than those with Delta. That's because the virus just doesn't stay in the throat for very long. And they estimate that people are infectious from about 2 days before they develop symptoms to about 3 to 4 days after they develop symptoms. So they've gone to 7 days. I think the UK has gone to 10 days, and Australia is considering going to either 7 or 10 days.
Well, yeah, it is a bit of a balancing act between actually having your economy running to a certain degree and the healthcare system and the health of the population. Now, finally, we're entering year 3 of this pandemic. A lot of people are extremely wary of the whole situation right now. We have all these vaccines out. We have the potential for a less serious version of COVID. At what point do you think we are going to reach? It seems like it has to be fairly soon when we aren't going to have to restrict to such a degree our own personal lives, perhaps to protect vulnerable healthcare systems.
Well, it's been tiring for epidemiologists too. And I don't have a crystal ball. This virus keeps ambushing us with new surprises. And the main problem we're facing is that in much of the world, the vaccination rate is very low. For example, across Africa, it's no more than 10% fully vaccinated. That means the virus can circulate and maybe mutate again. And we don't know. These mutations are random. They're basically mistakes the virus makes when it multiplies inside human beings. Now, the next mistake may make a new variant more severe. I don't want to scare people, but we just don't know how this virus is going to evolve. So I think it's just far too early to consider changing the way we approach this virus. I'm not suggesting lockdowns. We may have not need lockdowns anymore, but we will need these other restrictions that are proven to work. And finally, everywhere we need to pay more attention to ventilation indoors. And that's very important during the northern winter, when people gather inside out of the cold. And we need, I would suggest every hospitality venue should have a carbon dioxide monitor. And when the carbon dioxide level is above the threshold, they should either open all the windows and doors or close until it returns to normal.
Well, Professor Michael Toole, thanks as always for your insights. Mark and I and the whole team here, we wish you and your family a very happy and, of course, healthy New Year.
Okay, thank you.